What prompted the launch of the Young Nurses Indaba? And are nurses duly remunerated and rewarded for their job? What role do nurses unions play in addressing challenges, particularly in the public health sector? And are all nurses against wearing of white uniform? What time is it? It is question time. Welcome to Question Time. My name is Mpho Tsedu. Challenges in the health sector continue to elicit a variety of opinions. Recently, nurses took to the streets in an attempt to draw the attention of the authorities to the problems they encounter while performing their duties. Student nurses in Bloemfontein in the Free State refused to return to their wards and classes until outstanding stipends were paid to them. Hundreds of nurses under the banner of the Young Nurses Indaba marched to the health department offices in Pretoria and handed a memorandum of a number of demands. In the Eastern Cape, nurses marched to the provincial health offices in Bhisho, demanding an improvement of working conditions in the province's facilities. A reminder that we are live, and therefore you can call us and air your views. The numbers to dial 089-110-4210, our Twitter handle @QuestionTime24. My guest, Lerato Madumokova. She's the spokesperson of Young Nurses Indaba. Sipho Kangashe is the provincial organizer of Dinosa here in Gauteng. Welcome to Question Time. Young Nurses, Lerato, what is this Young Nurses Indaba? Why do you see your relevance to exist when there are unions already that are supposed to be addressing the plight of nurses?
Let me first greet you, Mpho, and obviously greet all the viewers at home. Young Nurses Indaba was founded on three things. The first thing was to unite nurses in the restoration of the image of the nursing profession, as well as empower nurses. It is a known factor that wherever you ask, when you say the word nurse, everybody thinks of a bad attitude. Everybody thinks of how they have been mishandled in the healthcare facilities by nurses. I mean, every one of us have a story to actually tell about our experiences with nurses. So Young Nurses Indaba started a campaign. We started engaging our peers and said, this is enough. We have to understand what is the root cause of this attitude and this rude and unbecoming behavior.
Do you know why?
We went and did a lot of workshops with all sectors of nurses. Mm-hmm. And what came out strongly there was that it is clear, it is something that we all know, the government knows it and the nurses know it. One, nurses really study extremely hard. After studying for more than 4-7 years, sometimes 10 to 13 years academically, not just their work experience, mm-hmm. the acknowledgement that they get from their employer, it's almost zilch to none. The fact that we have a lot of specialists within our ranks that really do sterling work on a daily basis. And yes, you might meet a bad nurse there and there, but there's also exceptionally good nurses. So over the years, it's been the thing of saying, guys, how do we then go back and say, these are our people, these are the communities that we serve. How do we redress the way they have been handled within our facilities? And that's where Young Nurses Indaba was born. But most important is to say the people that we've put into office from 1994 with the democratic dispensation was the ANC-led government, and we had all the faith in them to say they will change how nursing is trained, how nursing is developed, how nursing is actually supported. And on top of that, free healthcare was promised to all the citizens of SA. But up to thus far, it has been free, but we cannot say it has been quality.
But now, Lerato, why do you exist if SIPO still has to exist?
Nurses in South Africa are belonging to more than 10 unions. Dinosa as a union that actually organizes about 80 to 90,000 nurses in South Africa. When you look at the roll, we've got 260 nurses which belong to all other unions. You name it, Nehau, Hospesa, NAPSU, just to name the big four. But all in all is 10 unions. But over and above that, there's also associations that I've lost count of a nursing association that are actually focusing on specific groups of nurses that are looking at specialists on empowering them and ensuring. Young Nurses Indaba is quite different. It's actually saying, let us put those we have put in office accountable, including our unions. Our unions cannot just relax and not...
So they are useless.
We cannot really utter that. That's a very strong statement that we are going at.
No, it's a question I'm asking.
Yes, we cannot, from Young Nurses Indaba, we cannot say unions are useless. Unions will never cease to exist. They represent labor matters. They represent employees when they come to that. But when it comes to other issues, such as ensuring that we go back and address not reactive but proactive actions to say, really, where do we go when we have to speak life upon the profession? Somebody has got to do that dirty job, and that's where Young Nurses Indaba comes from.
Okay, Sipho.
Yes, sir.
Do you still see the need for you to exist?
Let me first greet you, Paul, and also greet the viewers at home. There is a greater need for unions to exist, especially DINOSA, which prides itself by only organizing nurses. We have a bigger role to play in the society and within the profession.
But what is your role if young nurses can launch Young Nurses Indaba in your midst?
Look, Paul, the one thing about the beauty of our country in this fledgling democracy is that we have a beautiful book called the Constitution, which talks to freedom of association. And as a trade union that advocates for that, we cannot trample on the views of others that they want to associate differently from ourselves.
Are they raising new matters?
These are old matters I can count.
Which you have failed to address?
No, let me tell you, we have not failed. We had a first union, 1996, under Nkosazana Zuma, that we introduced a review of salaries of nurses, and we succeeded. And in 2007, we pioneered OSD for nurses, which changed the salary nurses considerably. But we didn't say it's enough. We said we are not enough. We said we still want more, and hence we've been pushing that we need to review OSD, because the one that we had, it had challenges. But we said that, no, look, we need to review. And what we are having now as a challenge is that the employer is moving at the snail's pace. And we've been at this process since 2012 to say that, no, look, this matter is overdue. Because,
okay.
Yeah.
I want us to look at the demands which were obviously presented to the National Department and Provincial Department. But firstly, let's take Ntsikelelo. You are in the Eastern Cape.
Yes, it's Pugelo Tijana from the Eastern Cape.
Welcome.
Thank you very much. The point I wanted to make, I just wanted to comment is the Young Nurses Indaba, because the current unions, most of them have actually let us down.
Okay.
And the pressure they are exerting to these employers is minimal and it's measured, because they sleep with the same blanket with the employer. So I am really saying to YNI, go forward, and we are here to support you as nurses.
Okay. Simple?
Look, unfortunately or fortunately for the caller, this country, we have also a beautiful book called the Labor Relations Act, which regulates bargaining matters between the employer and employees. And it has rules as to arrive at a point whereby you decide to strike. So we are at the point where we haven't declared a dispute with the employer in terms of reviewing OSD salaries change for nurses. So we cannot simply say that we need too much out of that, because why would we have a country with beautiful laws if we cannot follow them? Because the important thing is to stick to the laws of the country, unless we want to say we want to review the laws of the country. And this is the challenge that we faced. Hence we have the foundation that is led by Herman Mashaba now wanting to take away the right that is so beautiful for workers, and they want to change that. And those are the challenges that we need to face as a union. And we always fight those issues so that we ensure that workers do not come second best on these issues.
Okay. What are the demands?
The demands are really clear. You need workers that are healthy, psychologically, mentally, financially, to take care of South Africans. It cannot be expected that a nurse that is garnished, that is under debt counseling, that is not supported in terms of health and wellness programs, non-existent in our country within the healthcare sector, that those people that experience traumatic events on a daily basis don't even have a health and wellness program set out for them. Our demands are really clear to say, why do you expect the nurses to wear any kind of uniform, white, black, green, you need to provide as the employer. The employer is not providing the uniform. It's giving a nurse 1.8 thousand a year to buy just 2 pairs of shoes. I don't even think it covers a shirt. Okay. And in that case, you are dealing with people that are touching all forms of soils, spills of blood, of liquor, meconium, I name it. It's an everyday occurrence. So in that case, we actually are saying the employer, you need to give the nurses so that those who come to our hospital do not get cross-infection. Supply them the same way as other departments are doing, SANDF, the police, the military. Provide those nurses so that they are able to deliver what's due.
Okay, we're going to take a quick break. When we return, we'll take our caller from Centurion. The number to dial is 089-110-4210. This is Question Time.
Get all the latest news from the SABC's online news services on our website. Breaking news and in-depth coverage of everything from business, sports to politics and lifestyle. Catch the top news clips and watch live streaming of major news events on the SABC News YouTube channel whenever. Stay connected on the SABC News Facebook page and have your say on news that matters to you. And for the latest headlines and live updates from our reporters, follow us on Twitter. SABC Digital News, anytime, anywhere.
Welcome back. You're still watching Question Time. My guest, Lerato Madumokova. She's the spokesperson of Young Nurses Indaba. And Sipho Kangashe is the Gauteng provincial organizer of the Democratic Nursing Organization of South Africa, the NOSA. And we're talking nursing issues. In Centurion, we've got Benkani.
Mr. Tedu, ki Begani.
Begani?
Yeah, ki Begani. You know,
oh, I'm very sorry, my brother.
It's okay, man. The guy that I spoke to initially could not pronounce, even if I corrected it. So, yeah.
Oh, yeah, no, that's fine. Welcome, Begani.
Thank you, Mr. Tedu.
Yes.
Mr. Tedu, let me tell you why Lerato thinks she's got to exist when Sipho is there.
Yes.
Isn't Benosa under Kosatu?
Mm-hmm.
It is. And Kosatu is in bed with the ANC. So, I mean, there are issues that Lerato will raise and that will be sort of softened up and all that, because as long as we've got this thing that the tripartite alliance, they've got to be a bit soft with the ANC, even if it means trampling on rights of other people, then you're always going to have Lerato. You'll always have them. And let me tell you why. I don't know why they keep on throwing this OSD thing as if the OSD came with a wonderful thing. Look, I'm a doctor by profession, and that OSD thing did nothing for us, really. They keep on throwing it and banning it around as if it did the most wonderful. There's lots of things that they did. For instance, when they brought in jams as a medical aid,
yes,
you'd find that on the OSD, they would actually said, the money that they've given you, you need to pay from that to pay for your own. And they would say they've subsidized your medical aid. And that's not true. They actually take it from that same OSD and they say they've subsidized. So this OSD thing, everybody is so happy about it, and especially the guys that implemented it, really is really nothing. You can ask Lerato, she'll tell you.
Okay. Peg, let me thank you for the time.
No, look, I think there's a misconception about OSD. And trust me, we're going to talk about it because we're proud. The nurse that was earning higher before OSD, it was 99,000. And that had changed from 99,000 to at least 168,000. So at the time, we wanted to move. And hence we said that it's not perfect and we are not enough. We say it must be reviewed, because that is a structure meant for nurses. Each category has its own OSD. Doctors have their own, nurses have their own. And unfortunately for nurses, it was a guinea pig, because we were the ones that were pushing that we want a dispensation for salaries of nurses. And hence it had the imperfections. But I cannot speak for other categories. But for nurses, yes, we know that it's not perfect. Hence we are pushing for review.
Now, Lerato, you're saying you don't want the white uniform?
I think let me reiterate that. We are saying the employer should provide the uniform from head to toe. The employer must ensure that if I work 7 days in a week, I'm able to dress up for that 7 days. And if there are spills on my clothes, I'm able to change 2 or 3 times a day. It is good sterile techniques as well as what is then expected of a person which works with people on a daily basis. So the white is not in the center. We're abolishing it to say, employer, if you're going for white, ensure that it covers across the board. If it's green, then do the same. The issue here really that is fundamental is that the employer cannot dodge his responsibilities and be worried when there is issues of Klebsiella within our hospitals, where there is people that are from theatre that cannot afford to get cross-infection, and they eventually, get those diseases. We cannot really afford that.
Let's take Melly in Foslo.
Hello.
Hi.
How are you, sir?
We're well. Thanks for the call, Melly.
Thanks. I'm calling just to say something on Dinosa and Young Nurses Indaba.
Okay.
Dinosa has been so relaxed and it's killing us. I'm so sure that Dinosa knows its function and it's doing well. But last year we were ComServed and we had a big issue where the government was just throwing out and we had contracts with the government. We called Dinosa. Dinosa just said, just sit and wait. Can you believe that most of us had job hunt knowing very well that we were just given a month to job hunt, and you knew very well that no one was going to hire you by then. And I think now we need people like Lerato and Young Nurses Indaba that will put pressure on Dinosa. Dinosa needs to start standing up and doing its function.
Okay.
Dinosa, truth be told, you are so relaxed and you're failing us. And on the salaries, have you seen our salaries? What is that? We can't afford anything. It's not fair, really. It's not.
Dinosa, you're selling out.
Not true. Let me start with the issue of ComServers last year. Unfortunately, that is not true. The chairperson of the province,
But Sipo, can everybody really just be against Dinosa?
Look, I said that...
I'm battling to find a caller who has come and said Amandla Dinosa.
Unfortunately, 3 people cannot determine out of more than 80,000 of membership that we have.
You're a scientist who work on research basis. This is a sample.
Unfortunately, nursing is a science. So I cannot work outside the parameters of science if nursing is a science. So I'll also say that only 3 people that cannot say that, no, we are not saying enough. One was a doctor, the other 2 probably nurses. So on those bases, we cannot say that, no, Dinosa is failing. But I can tell you that the issue of ComServers, we've addressed it through our chairperson, Comrade Simpiwe Gara, last year. And the issue that was a problem, it was resolved with the Department of Health. And we've always been tackling the issues. Issues of uniform. We were the first as Dinosa to say we don't want uniform.
What have you done?
White uniform. Let me tell you, when Mutsualedi said, Minister Mutsualedi, sorry, to say that he wants nurses white uniform, we said no. If you want white, provide. As long as you are not providing, leave it. And we also told him that, no, look, these issues, we discuss them at the bargaining chamber. As long as you are going to address press conferences and say you want white, we are not going to accept it. But what is happening is that there are no team managers in the departments that are forcing white uniform on members. And we've been running around trying to change that. Even today, I've been running in the West End, trying to conscientize members that we are saying no white uniform until the employer provides, because we know the challenges that comes with white uniform. We've been very clear on that position. We have never changed.
Silo, you are in Midrand.
Hi, how are you, Sipo?
Mpo is the name.
Yeah, Mpo, thank you.
Yes.
Yes, Mpo, I'm speaking to Silo Mutsogo. The 2 colleagues there will remember me very well from our days at the college.
Okay.
Thank you very much. I'm disappointed that since ever about this formation of Young Nurses Indaba, Dinosa has felt threatened by the existence of this movement, as if maybe those poor nurses want to replace them. And that's not the case. I've been listening attentively to what Sipo said, and I'm disappointed because now he's talking about the beautiful laws of this country, about the beautiful bargaining rights we've got. But is he there to protect those beautiful laws, or he should be there to protect the nurses' plight? That is the first question that I need to ask him. And secondly, I need him to clarify to me that apart from OSD, we shouldn't talk about OSD because it's also an insult to the nurses. Apart from the OSD, what drastic steps have they taken as the representative of nurses to ensure that the nurses get the better salaries?
Okay.
None at all.
Silo.
But he dares to come to the. Let me finish. He
Yes.
dares to come to the question time and tell people that we've got beautiful laws. Are those beautiful laws protecting the nurses that he represents himself? And lastly, my last point to Lerato, I just want to tell you, Wanako high or no, the whole South Africa is watching. We know what we expect from Dinosa, we know what we expect from Hospesa. They are failing to deliver. We as nurses will take it upon ourselves to make sure that nurses are happy in this country.
Okay. It's 4 out of 4 who are saying, Dinosa, you are not on the right track.
Look, like I said, I don't want to go into those dynamics of science again, but I still maintain the answer. But let me deal with one question that I've heard. I've also heard that I'm not representing nurses, I'm representing myself. I'm not sure about, but I've only heard one that says that what are we doing after OSD? And probably the word that I'm using of review does not sound properly. But let me use clearer English. We said that those salaries are little, are not enough in terms of the load work that is on the ground when nurses are working. We said that we want a change. We want salaries.
But the young nurses said they wanted change and they were on tools down.
Look, they were on tools down, yes. That is the issue of Young Nurses Indaba, and we are not threatened by Young Nurses Indaba. If nurses, they want to group themselves and want to formalize themselves somewhere and raise issues, that is one of the constitutional rights they have.
Okay.
But we are still sticking to say that we are pushing.
All right.
We have on record.
Let's take a very important caller here as well. I was waiting for your call. Itumele. I'm well. Thank you very much for your call.
Okay, I want to say to Dinosa has failed. You know, those are the old unions, the unions who rely too much on the ANC party. They think because of their many, they could do as they wish at their time. Mm. And then I want to say to Lerato, it's very good that it's very good for them to have what they're having. But the problem is that we must not find ourselves in a situation where we start to meet unions at our workplace. Okay. Where at the end of the day, you find that now unions are the ones who are in charge of running our work, like what SATU is doing, and again like what the NOSA is doing. Okay. If maybe they get what they want, will they be able to can start working with the employer? Okay. You know, we need to balance the two.
All right. Thank you. I'll give you time to respond to that. I just want to quickly check out our tweets and see. Mzwandi Lesbinda says, unions like Dinosa don't care about us nurses. Oh, Sipo, you're in trouble here. They only want to support COSATU and ANC so that they can get higher positions. Okay. Muntu Shabalala says, nursing is at ICU. It's in a critical state. That's true. Lerato Gambu, sporadic rise of unions is worrying. Worker issues compromised because of pseudo leaders' selfish interest. Whoa, Lerato.
I think the callers and the tweets that we just read really sums it up. It is time. I mean, you look at other government entities, and I'm always moved by the Department of Home Affairs and SARS. They're still government. They are well run. Why the snail pace in health when people are actually dying? Someone mentioned something about the ICU. You cannot have 10 patients and 2 nurses when you've got critically ill people. And every time when our government is put to account, all they're saying, it's a nice PR exercise.
But
I think,
Lerato, are you also going to work on the attitude of some nurses towards patients?
Of course.
Because I'm telling you, there are people with experience out there, and it's not the most pleasant of them.
I think when I started, that's where I hit it on the nail to say, when we formed Young Nurses Indaba, it was never to start a union. It was never to start a fight with the department or anybody. The attitude of nurses, some of our colleagues, it's not desirable. And all that has been done in the name of nurses that really have come, not because they've got a calling. And we don't, actually when you say calling, you're talking about a K word to a nurse. Because when you look at the calling itself, it's somebody that can work without money. Okay. But when you go into the nitty-gritties of...
Thank you. Unfortunately, we have run out of time.
All right.
Sipho, I wish you all the best, because I can see that politically you are under siege. Nurses are not very happy with what DINOSA is doing, but we wish you all the best. Unfortunately, we have run out of time. We can continue this discussion off air.
Okay.
But yeah, that was question time for today, a very important day in other countries as well. And a big thank you to my guests and to you for watching the show. Have yourself a wonderful time. Goodbye.
Get all the latest news.